My name is Dr. Aravindan Tharakad. I am an orthopedic surgeon who specializes in trauma as well as pediatric orthopedics. So a fracture is actually one of the most common complications or common issues that all patients come and approach the orthopedic surgeon. So a fracture is basically nothing but a discontinuity in the bone or a small break in the bone. Over a period of time, many people say hairline fracture, break, crack, fracture, all these are all the same thing. If there is a break in the bone or a discontinuity in the bone, it is automatically a fracture. Now, fractures can be treated in multiple ways. Fracture healing per se is a natural process. So, that is a natural God-given process which will heal on its own. The job of the orthopedic surgeon is to try to find the best way for the fracture to heal. So that could be either by just doing a normal kind of casting or a POP casting, or it could be something to the point where we need to operate and put a plate or a screw or a nail. So as far as a fracture is concerned, a treatment of a fracture, what we always say is that we want the patient to walk as fast as possible, or we want the patient to start doing their activity as fast as possible. We don't like a patient to be immobile. We want the patient to walk. We want the patient to be a part of society as soon as possible. For which we need to try to augment this fracture healing by making sure that it heals and it also heals in the right position so that it can allow the body process to take over naturally. So in this, many of the times, especially in elderly people, they'll always have fractures around the hip. So in fractures around the hip, we want to make sure that the patient is getting up as soon as possible, walking as soon as possible, being able to go back home as soon as possible, so that they prevent any sort of issues such as staying in bed for a very long period of time. And we do this in terms of operating with either plates or screws or nails, depending on how bad the fracture is, depending on how good the bone is, and also depending on how the general condition of the patient is.